This patient came in with a lot of GI complaints, gas, bloating, diarrhea, constipation, and he had been to other physicians to try to figure out what was going on. But no one had done a stool analysis to really figure it out. And so that's the first thing we did. We figured out that he was dealing with bacterial infection and a fungal infection. And where's that coming from? If you have belly issues and don't know why, there's a lot we can do to figure it out. A good history is the most important thing, and we talk a lot about food in my practice, what you're eating, what kind of sleep you're getting, your stress, but we also can look into the body to see what's going on. One of the tests I really like to do is something called the GI Effects from Genova Diagnostics, because it really looks at a bunch of things. It looks at if you have enough components to break down food for absorption, if you have inflammation in the lining, if you have an imbalance in all the good bacteria that should be there, if the good bacteria is in the right place, or if there's bad bacteria. We look at all of those. We look and see if there's parasites or any creepy crawlies that shouldn't be in there. And when we find something, we can actually look and see what it is and what to do about it. So when we look at this one, we can see that this person had high Klebsiella, but they also had high Candida. Klebsiella is a bacteria, and Candida is a fungus. And so now we know more specifically how to treat this person and what to target. So once we identify what's going on, there is a lot of antimicrobial agents we use that are natural. And there are some that if we find a bacteria that needs an antibiotic, then we figure that out too. But oftentimes we can use herbs and supplements to help bolster the body. A lot of times we just need to increase the good bacteria in the gut in order to crowd out the bad bacteria, and the body does the magic. So when we started treating this patient, the way we started was we wanted to crowd out the bad bacteria. And so the one supplement that really worked well for them was Ultraflora IB from Metagenics, because it has 60 billion beneficial bacteria in it that we can help start crowding out that bad bacteria. We also use from Metagenics Candibactin AR and BR, an oregano and thyme blend, and a berberine blend, and that helps decrease the Klebsiella or the bacterial component of it. And then we also gave from Thorne formula SF722 or undulacenic acid, which is a great antifungal. And so that was what really helped this patient get through his symptoms and have a healthier GI system. If you're curious about what's going on with you, hit me up and let's talk.